Have you ever wondered why so many heart attacks and strokes seem to strike just after sunrise, when the day is only beginning and the body should feel refreshed? It sounds strange, but this pattern is real, and it has been confirmed again and again by large medical studies across the world. What makes this even more important is that understanding this timing could help save lives, including yours or someone you love. Stay with me until the end of this video because you'll learn simple, proven steps that can dramatically reduce this silent morning risk. For decades, doctors and researchers noticed something unsettling. Emergency rooms become busiest with heart attacks and strokes during the early morning hours, especially between 6 in the morning and noon. This isn't random. It happens across different countries, lifestyles, and age groups. Even people who feel fine when they go to bed can wake up facing a life-threatening event just hours later. The body follows a biological clock, known as a circadian rhythm, and this clock strongly affects the heart and blood vessels. When you wake up, your body shifts from rest mode to action mode. This change is sudden. While you're asleep, your heart rate slows, your blood pressure drops, and your nervous system stays calm. But as morning arrives, your body prepares you to stand, move, think, and respond. To do this, it releases stress hormones, especially cortisol and adrenaline. These hormones are not bad, they are necessary, but the timing and intensity of their release can create a dangerous window for some people. In the morning, blood pressure rises quickly. This surge helps push blood to the brain and muscles so you can function. At the same time, the heart begins to beat faster. Blood vessels tighten slightly to maintain pressure. For a healthy person, this is usually safe, but if the arteries are already narrowed by plaque or the heart is already under strain, this sudden demand can overwhelm the system. There is another critical factor many people don't realize. Blood is naturally thicker in the morning. During sleep, you don't drink water for several hours, which leads to mild dehydration. As a result, blood becomes more concentrated. Platelets, which help blood clot, are also more active in the early morning. This combination increases the chance of clot formation. A clot that blocks blood flow to the heart can cause a heart attack. A clot that travels to the brain can cause a stroke. This explains why mornings are especially risky for people with high blood pressure, diabetes, high cholesterol, or a history of heart disease. The arteries in these individuals are often less flexible and more prone to blockage. When pressure rises fast and blood thickens at the same time, the risk multiplies. This is not fear-based information. This is physiology. It's how the human body works. The good news is this: once you understand why mornings are dangerous, you can take control. You can work with your body instead of against it. In the rest of this video, you'll learn how to reduce that morning surge, protect your heart, and lower your risk using methods supported by solid medical research. These are simple changes, but they can make a powerful difference. Now that you understand why the morning hours create a dangerous window, it becomes essential to look deeper at what is actually happening inside the body during those first moments after waking. This is where science gives us very clear answers. These changes are not guesses or theories. They are well-documented physiological responses that happen to almost everyone, every single day. As the body transitions from sleep to wakefulness, the nervous system shifts gears. During sleep, the parasympathetic nervous system dominates. This system promotes rest, repair, and relaxation. Heart rate stays low, blood pressure remains reduced, blood vessels stay more relaxed. But when morning arrives, the sympathetic nervous system takes over. This is the system responsible for alertness, movement, and readiness. It activates quickly and sometimes aggressively. One of the first changes is a rapid rise in cortisol. Cortisol is often called the stress hormone, but that label is misleading. Cortisol plays a vital role in regulating blood sugar, metabolism, and blood pressure. It follows a natural rhythm and peaks in the early morning to help you wake up. However, elevated cortisol also increases blood pressure and blood glucose. In people with insulin resistance, diabetes, or chronic stress, This surge can be stronger and more harmful. At the same time, adrenaline levels increase. Adrenaline makes the heart beat faster and stronger. It narrows blood vessels slightly to maintain blood pressure when you stand up. This is useful, but it also increases the workload on the heart. If coronary arteries are narrowed by plaque, even slightly, the heart muscle may not receive enough oxygen during this sudden demand. This oxygen imbalance is a key trigger for heart attacks. Blood pressure follows a similar pattern. During sleep, blood pressure naturally dips. This is known as nocturnal dipping, and it is a sign of a healthy cardiovascular system. But upon waking, blood pressure rises sharply. This is called the morning blood pressure surge. Research has shown that an exaggerated morning surge is strongly linked to a higher risk of heart attacks and strokes. In fact, people with uncontrolled high blood pressure experience a much steeper rise, placing extra stress on artery walls. Blood itself also behaves differently in the morning. After several hours without fluids, the blood becomes more concentrated. This increases viscosity, meaning it flows more slowly and thickly. Thicker blood raises resistance inside blood vessels and makes the heart work harder to pump it. More importantly, platelet activity increases in the early morning. Platelets are responsible for clot formation. When they become more active while blood is thicker, the chance of an unwanted clot rises significantly. Another often overlooked factor is endothelial function. The endothelium is the inner lining of blood vessels. It helps regulate vessel dilation and blood flow. In the morning, endothelial function is temporarily reduced. This means blood vessels are less able to widen when needed. Reduced dilation combined with higher pressure creates the perfect environment for vessel injury or rupture, especially in weakened or inflamed arteries. Breathing patterns also change. During sleep, breathing is slower and deeper. Upon waking, breathing becomes faster and more shallow. In people with sleep apnea, oxygen levels may have dropped repeatedly during the night. This lack of oxygen places stress on the heart and triggers inflammation. When the morning surge hits on top of that stress, the cardiovascular system is already compromised. These changes don't happen in isolation. They occur together within a short time frame. Rising hormones, increasing blood pressure, thicker blood, higher heart rate, and reduced vessel flexibility all collide in the morning hours. For healthy arteries, the body usually adapts. But for arteries affected by plaque, inflammation, or stiffness, this collision can be catastrophic. This explains why many heart attacks and strokes occur shortly after waking, often during routine activities like showering, rushing to work, or climbing stairs. It's not the activity itself that causes the event. It's the sudden demand placed on a system that is already under intense internal pressure. Understanding these internal shifts is empowering. It reveals that morning cardiovascular events are not sudden or mysterious. They are predictable responses to biological rhythms interacting with underlying risk factors. When you know what stresses the system, you can take steps to reduce that stress and protect the heart when it is most vulnerable. Proven ways to reduce morning risk. Once you understand how intense the morning strain is on the heart and blood vessels, the next critical question becomes, who is most vulnerable during this time? The truth is, not everyone faces the same level of danger. Some bodies can adapt to the morning surge without trouble, while others are pushed beyond their limits. This difference is not about luck. It is about underlying conditions that quietly weaken the cardiovascular system over time. High blood pressure is one of the strongest risk factors. When blood pressure is already elevated, the morning surge adds extra force against artery walls that may already be stiff or damaged. This repeated pressure weakens vessels, increases inflammation, and raises the chance of plaque rupture. A ruptured plaque can trigger an immediate clot, blocking blood flow to the heart or brain within minutes. Diabetes significantly increases morning risk as well. Chronically high blood sugar damages blood vessels and nerves that control heart function. It also increases inflammation and makes platelets stickier, which promotes clot formation. Many people with diabetes experience stronger cortisol surges in the morning, leading to sharp rises in blood sugar and blood pressure at the same time. This double stress places the cardiovascular system under extreme strain. High cholesterol plays a major role by contributing to plaque buildup inside arteries. These plaques narrow the passageways that supply oxygen rich blood to vital organs. In the morning, when the heart needs more oxygen due to increased activity and hormone release, narrowed arteries may not be able to keep up. This mismatch between supply and demand is a common trigger for heart attacks. Smoking further magnifies morning danger. Nicotine causes immediate constriction of blood vessels and raises heart rate and blood pressure. Many smokers light up soon after waking, exactly when the cardiovascular system is already under stress. This sudden constriction reduces blood flow while increasing demand, creating an extremely high-risk situation. Smoking also damages the endothelium, making arteries less flexible and more prone to clot formation. Sleep disorders, especially sleep apnea, are another major but often overlooked risk factor. During sleep apnea, breathing repeatedly stops and starts, lowering oxygen levels throughout the night. This forces the heart to work harder and triggers stress hormone release even before morning arrives. By the time a person wakes up, their cardiovascular system is already inflamed and exhausted. When the normal morning surge occurs, it can push the system into failure. Chronic stress deserves serious attention. Long-term stress keeps cortisol and adrenaline levels elevated beyond healthy limits. This disrupts the natural circadian rhythm and exaggerates the morning hormone spike. Over time, chronic stress contributes to high blood pressure, insulin resistance, and inflammation, all of which increase the risk of morning cardiovascular events. Physical inactivity also plays a role. Regular movement improves blood vessel flexibility, lowers resting heart rate, and enhances the body's ability to handle stress. Inactive individuals tend to have stiffer arteries and poorer blood flow regulation. When morning demands increase suddenly, their cardiovascular system has less reserve to adapt. Age is another factor, but not in isolation. As people get older, arteries naturally lose elasticity. However, age combined with poor lifestyle habits accelerates this process. Older adults with multiple risk factors experience a much higher likelihood of morning heart attacks and strokes than those who maintain good metabolic and cardiovascular health. Previous cardiovascular events dramatically increase risk. Anyone who has already experienced a heart attack or stroke has vulnerable areas in the heart or brain. Scar tissue, weakened vessels, or reduced blood flow make the system less forgiving. The morning surge can easily target these weak points if protective measures are not in place. What makes all of this especially dangerous is that many of these risk factors do not cause obvious symptoms. A person may feel normal, go to bed feeling fine, and wake up unaware that their heart and blood vessels are entering the most dangerous phase of the day. This is why awareness matters. Knowing your risk is the first step toward prevention. The powerful message here is not fear, but control. Risk factors are not destiny. Many of them can be managed, reduced, or even reversed with the right daily habits and medical guidance. When you understand why the body struggles in the morning and who is most affected, you gain the ability to protect yourself during the hours that matter most. Proven ways to reduce morning risk. Once you recognize who carries the highest risk, the most important step is learning how to protect the heart during its most vulnerable hours. Prevention is not complicated, but it must be intentional. Small actions taken consistently can reduce the morning strain on the cardiovascular system and dramatically lower the chance of a sudden event. These strategies are supported by decades of clinical research and are widely recommended in preventive cardiology. The way you wake up matters more than most people realize. Jumping out of bed and rushing into activity forces the heart to respond instantly to physical and hormonal stress. A slower transition allows the nervous system to adjust more smoothly. Sitting up for a moment, taking calm breaths, and allowing circulation to stabilize before standing can reduce sudden blood pressure spikes. This gentle start gives blood vessels time to adapt. Hydration plays a critical role in morning protection. After hours without fluids, blood becomes thicker and harder to pump. Drinking water shortly after waking helps restore blood volume, improves circulation, and reduces blood viscosity. This simple habit lowers the workload on the heart and decreases clotting risk. Water should come before coffee because caffeine can temporarily raise blood pressure and heart rate, especially in sensitive individuals. Medication timing is another essential factor for those under medical care. Blood pressure medications, cholesterol-lowering drugs, and antiplatelet therapies are prescribed to control the very risks that peak in the morning. Skipping doses or taking them inconsistently removes that protection when it is most needed. Many long-acting medications are designed to blunt the morning surge, which is why adherence is so important. Any changes in timing should always be guided by a healthcare professional. Sleep quality cannot be overlooked. Consistent, restorative sleep helps regulate cortisol levels, blood pressure rhythms, and glucose control. Poor sleep disrupts circadian patterns and amplifies morning hormone surges. Addressing sleep disorders such as sleep apnea is especially important, as untreated apnea significantly increases cardiovascular risk. Proper sleep allows the heart to recover and prepares the body for a smoother transition into the day. Morning activity should be approached with awareness. Light movement is beneficial, but intense exertion immediately after waking can overload the heart. Gentle stretching, slow walking, or breathing exercises are safer ways to activate circulation early in the day. More vigorous exercise is better tolerated later once blood pressure and heart rate have stabilized. This timing reduces stress on the heart while preserving the benefits of physical activity. Nutrition also influences morning risk. Skipping breakfast can increase cortisol and blood sugar fluctuations, especially in people with metabolic conditions. A balanced morning meal that includes fiber, protein, and healthy fats supports stable blood sugar and reduces stress hormone release. Highly processed foods and excessive sugar should be avoided as they can worsen inflammation and insulin spikes. Stress management is not optional when it comes to heart protection. Chronic stress keeps the body in a constant state of high alert, exaggerating the morning surge of cortisol and adrenaline. Simple practices such as controlled breathing, mindfulness, or quiet reflection in the morning can calm the nervous system and lower blood pressure. These techniques are proven to improve heart rate variability and reduce cardiovascular strain. Smoking cessation is one of the most powerful steps for reducing morning risk. Avoiding nicotine, especially in the early hours, prevents sudden vessel constriction and pressure spikes. The benefits of quitting begin almost immediately, with improvements in blood vessel function and oxygen delivery occurring within weeks. This single change can significantly reduce the likelihood of heart attacks and strokes. Regular physical activity strengthens the heart over time and improves the flexibility of blood vessels. Exercise enhances the body's ability to handle stress and reduces exaggerated morning blood pressure surges. Consistency matters more than intensity. Even moderate activity performed most days of the week lowers resting heart rate and improves overall cardiovascular resilience. Monitoring health markers provides another layer of protection. Keeping blood pressure, blood sugar, and cholesterol within healthy ranges reduces the strain placed on arteries in the morning. Routine checkups and early intervention prevent silent damage from progressing unnoticed. Prevention works best when risk is identified early and managed proactively. The key message is empowerment. Morning heart attacks and strokes are not random events. They follow predictable biological patterns that can be influenced by daily habits and informed choices. By respecting the body's rhythms and supporting the cardiovascular system during its most demanding hours, you shift the odds strongly in your favor. These changes do not require perfection. They require awareness and consistency, proven ways to reduce morning risk. The strategies to protect the heart in the morning are simple, but their impact is profound when practiced consistently. One of the most effective approaches is maintaining a daily routine that supports cardiovascular health. Consistency in sleep, hydration, meals, and activity patterns helps regulate the body's natural rhythms and prevents sudden stress on the heart. Going to bed and waking up at the same time every day ensures that cortisol and blood pressure follow a predictable pattern, reducing the intensity of the morning surge. Irregular sleep schedules or chronic sleep deprivation can throw these rhythms off, making the cardiovascular system more vulnerable. Hydration should be treated as a foundational habit. Overnight, the body loses water through breathing and sweat, thickening the blood. Drinking a glass of water immediately upon waking improves blood flow, reduces viscosity, and lowers the workload on the heart. This simple action is an easy but powerful way to counteract one of the most dangerous aspects of the morning period. Pairing hydration with gentle movement or stretching can further enhance circulation without triggering sudden spikes in heart rate or blood pressure. Medication adherence remains one of the most scientifically proven ways to reduce risk. Blood pressure medications, statins, and antiplatelet drugs are all designed to target the factors that peak in the early hours. Skipping doses or inconsistent timing removes that protection exactly when the heart and vessels need it most. For people with high blood pressure or previous cardiovascular events, taking medication as prescribed has been shown to dramatically lower the incidence of morning heart attacks and strokes. Combining these medications with lifestyle adjustments multiplies the protective effect. Gentle morning activity is another cornerstone of prevention. Activities such as light stretching, slow walking, or deep breathing help awaken the body without overloading the cardiovascular system. This is particularly important for older adults or those with existing heart conditions. Sudden exertion immediately after waking can trigger dangerous events, whereas gradually activating the body allows blood vessels and the heart to adjust to the increased demand safely. Over time, this approach strengthens the body's tolerance to stress and improves overall cardiovascular resilience. Nutrition in the morning also plays a critical role. A balanced breakfast stabilizes blood sugar, prevents excessive cortisol spikes, and supports steady energy levels. Including fiber, protein, and healthy fats can prevent rapid fluctuations in glucose and insulin, which are linked to arterial stress. Avoiding highly processed foods and excessive sugar in the morning prevents unnecessary inflammation and supports optimal vascular function. Even small improvements in morning nutrition, practiced consistently, have measurable effects on heart health over time. Stress management techniques further strengthen morning protection. Chronic stress keeps the sympathetic nervous system active and exaggerates the natural cortisol surge, increasing blood pressure and heart rate. Practicing mindfulness, controlled breathing, or quiet reflection upon waking helps calm the nervous system and reduce strain on the heart. Research consistently shows that people who engage in even brief morning stress relief practices have lower blood pressure, reduced heart rate variability, and improved overall cardiovascular health. These practices train the body to respond more calmly to both internal and external demands. Smoking cessation is essential for anyone concerned about morning heart attacks or strokes. Nicotine constricts blood vessels and raises blood pressure, particularly during the early hours when the cardiovascular system is already stressed. Quitting smoking restores vessel flexibility, improves oxygen delivery, and reduces clotting risk. The benefits of quitting begin within weeks, and the protective effect grows steadily over months and years. Avoiding nicotine in the morning, even temporarily, reduces the acute stress that can trigger dangerous events. Regular exercise outside the morning period also strengthens the cardiovascular system. Consistent physical activity improves arterial flexibility, lowers resting heart rate, and enhances the body's ability to handle hormone and blood pressure fluctuations. Even moderate exercise, performed most days of the week, significantly reduces the risk of heart attacks and strokes, especially during vulnerable morning hours. Exercise works best when it is predictable and incorporated into a balanced lifestyle that includes adequate rest and recovery. Monitoring health markers provides additional protection. Keeping track of blood pressure, blood sugar, cholesterol, and body weight helps identify early signs of risk. People who manage these metrics proactively reduce the stress on their arteries during the morning surge. Routine checkups with healthcare professionals allow timely adjustments to medication, diet, or lifestyle habits, reinforcing all the preventive measures already in place. Awareness and proactive management create a powerful safety net that supports cardiovascular health every day. Understanding and acting on these habits is empowering. The morning hours, once a period of hidden danger, can become a time of strength and protection. By aligning sleep, hydration, medication, nutrition, gentle activity, stress management, and regular exercise, the body is better prepared to handle the natural surge in blood pressure, heart rate, and hormone levels. These strategies are not complicated, but they are highly effective, backed by research, and accessible to anyone willing to adopt them. When practiced consistently, they shift the odds in favor of a healthier, safer morning, turning vulnerability into resilience. How to protect your heart from morning surges. Protecting your heart from morning surges is not just about avoiding danger, it's about actively supporting the body when it needs it most. Every morning, the cardiovascular system faces a sudden increase in stress, and the measures you take can either amplify risk or provide powerful protection. The key is creating a routine that respects the body's natural rhythms while addressing the factors that make morning hours the most dangerous. This approach combines science, consistency, and awareness to create real measurable results. Starting the day calmly is essential. When the alarm rings, resist the urge to leap out of bed immediately. A gradual wake-up allows the nervous system to adjust before the heart is required to respond to physical demands. Sitting on the edge of the bed, taking a few deep, controlled breaths, and gently stretching major muscle groups gives blood pressure and heart rate time to stabilize. Even a few minutes of this simple ritual can significantly reduce the intensity of the morning surge and prepare the heart for safe activity. Hydration is another cornerstone. Overnight, the body loses fluids through breathing and perspiration, thickening the blood and increasing its tendency to clot. Drinking water immediately upon waking replenishes fluid balance, improves circulation, and lowers stress on the heart. Starting the day with hydration before caffeine also prevents sudden increases in blood pressure that coffee can trigger, especially in people sensitive to its effects. This small but consistent habit forms the foundation of morning cardiovascular safety. Medication management plays a crucial role for anyone with hypertension, high cholesterol, diabetes, or prior heart or stroke events. Taking medications consistently and at the times prescribed ensures that the heart and blood vessels are protected during their most vulnerable hours. Long-acting medications are designed to reduce morning surge